Good morning, good evening, good afternoon, good night, wherever you are in the world. Welcome to #Find the Pioneer talk show series. I'm your host, Jesse Forrester, and I'm super excited to have you here as we discuss today's theme about energy and healthcare. Just to remind you, #Find the Pioneer is an initiative launched by the Zayed Sustainability Prize in order to find young and innovative people, businesses, and SMEs that are doing great work in the field of sustainability. We're looking at energy, water, healthcare, and food, as well as global high schools. So if you have a pioneer that you know that's doing amazing stuff, do make sure that you inform the Zayed Sustainability Prize at info@zayedsustainabilityprize.com, and they will be sure to contact the pioneer. That being said, today's guest is someone that I have met before in Abu Dhabi, and he's doing amazing work. Welcome to the talk show, Thomas Rieger, CEO of Solar Kiosk and the 2020 Zayed Sustainability Prize Energy finalist.
Jesse, thank you so much for having me. I'm excited.
It's my pleasure. So this is kind of interesting discussion that we're going to have because we're looking at a confluence of themes, right? And so to get into it, obviously, thank you so much for making the time to be with me here. And to begin with, can you tell us a little bit more about your organization, Solar Kiosk, turnkey solutions, objectives, and long-term plans?
Yeah, of course, Jesse. Thank you so much. Solar Kiosk, we are actually not some very young company. We've been around in the field since 2011, doing what we set out to do. And so you cannot say that we're new in the field, but we've always been, at a very innovative pace, I can say. In 2011, we kind of found our love to support today's sustainable development goals, to bring universal access of energy, especially in those regions where they're far off grid, where there's last mile communities and so on and so forth. So what we did, we were looking at, how can we improve the situation that currently is at. And solar technology is not something new. Even at that stage, I was starting in the solar industry in 2004. So it was somewhat a mature technology that needed to go in those locations in order to help to create sustainable access to electricity. What we did and what we found out is that in order to penetrate those markets, to be there, to advise the consumer, to give him access to products, you got to be there, and you cannot be there if you don't have infrastructure and proximity to the client that you need in order to be able to distribute those products, to deliver services, to get onto your maintenance promises, and so on and so forth. So what we did is we invented a solar-powered infrastructure solution, the eHub or the kiosk, which is in our name, Solar Kiosk, in order to be able to go to the last mile, no matter where that is, in a very fast time, but to build something of a structure that is solar powered, that connects you to the internet, that brings light, that has productive use appliances inside, and go to the market. We did that for many, many years, especially in your country, in Kenya. We had a very large presence. We covered everything from Nairobi over to Kisumu up to Eldoret. I had a lot of installations there and worked a lot with the communities in there. And that is our motivation, our drive ongoing in the future to increase our presence and to really go into the last mile and work with the communities and achieve, Sustainable Development Goal 7, which is universal access to renewable energy. And that's what we really set out to do there.
Yeah. I also really like how sort of tailored your solution is, as you said, like getting into the community and building that very necessary infrastructure. Because energy is super important, right? And that actually leads into my second question. Energy access is often seen as a catalyst to wider social and economic development. The reality, though, for over 1.1 billion people around the world is living with the absence of electricity. I think 600 million of those are actually in sub-Saharan Africa.
Yeah.
So, in your opinion, why is reaching universal access still a challenge?
That, Jesse, is a multifaceted issue, if I can say. But I will start from where we came at and what I was able to explain before. I mean, it starts on the ground. It starts with, an approach that is inclusive within the community. When we came out there, what we saw was, some sales agents coming in a location, dropping off some cheap quality products. They left. So when we came, solar was not a new topic, but nobody believed in it. And you remember those times, everybody said, hey, solar doesn't work, And, a lot of organizations did a lot of groundwork to do that. I'm mentioning the IFC with their Lighting, Africa program. I'm mentioning, there's so many out there, you know them, they did the tremendous work, but the connection point to be in the community where you are at, that was always missing. So I'm pointing a little bit also to this last mile distribution issue. You've got to be there where you're gonna work. I think that's if you look at it from a bottom-up perspective, isn't it?
Exactly.
The second one for me is access to finance. I mean, over the past years, we have heard pay-as-you-go from every channel when you're working in our industry, and you know the topic, right? But pay-as-you-go was nothing else than solar companies thinking about, why are we not selling? It's very easy because nobody would have the upfront cash to even buy, a small Pico light, and then let alone a home system or whatever is out there to electrify your own home, to be able to charge your telephone, and just basic things that you and I take for granted as we're living somewhere there's a grid connection, isn't it? So the lack of finance and the unwillingness of traditional, finance institutes, or even the lack of banks, the non-bank population, where you can match it with the non-electrified population, by the way. How do you give them access to this technology that's there? And that's actually quite affordable in our terms, but it's not affordable for somebody that earns $2 a day and needs to see how he's going to feed, how he's going to educate his children, how he's going to buy seeds and fertilizers for the next season of planting. So how do you do that? And then pay-as-you-go was invented, isn't it? But that, there is so many more things that we could say about this access to finance issue, where traditional MFIs and banks are still resisting today, because I understand they're not the energy specialists. But at some stage, we got to realize, there is an issue and it needs to be dealt with. And the third one, if you go further back up and you say there is a policy issue as well, still today. How do you achieve universal access to electricity? There are several ways how you can do that. You can extend the grid, you can work with coal-fired plants, you can install, whatever, or you can also embrace and enhance, decentralized energy generation, right? But if I look at, the cost of extending the grid in the last mile to connect one household is like exorbitant. Whatsoever, many people are going down that road, and you wonder, all the money that flows into there, all the finance that goes into this sector, if policy would stand up today and would say, okay, we need to embrace this technology that is there, that is ready, that can scale very, very quickly if we put decentralized renewable energies out there to be part of our national electrification strategy, and pursue this much more and put some of that huge finance that goes into, transmission lines and I put some of that money into, renewable energies, then you would have a well-rounded picture. I could go more into details, but I think these are still a lot of issues that are holding the universal access to electricity back a little bit.
Okay. I'm a huge fan, actually, of decentralized solutions. Definitely, I think also there's a case to be made for employment, because if you have communities around that are managing the decentralized solution, then you've got a way to actively employ them and have them take advantage of that solution that you're offering, right? Right. So it's interesting that you've played it out as a three-pronged perspective when you're looking at, there's a policy issue, there's an issue with actual financing, and you have to be on the ground. You have to be there, directly taking into account what scenario you're in. As you mentioned, we are quite lucky that we can sit here and have a discussion and not worry about certain issues, especially energy in our case. So laying it bare as you have, the already challenging aspects when it comes down to this last mile distribution of energy. Right now, we are in a global pandemic. It's business unusual, if I could say it like that. So how, in your opinion, can solar kiosks' competencies, already you've been doing great work, but be deployed to support efforts against disasters and disease outbreaks in particular?
Well, let's take the first point, the disasters, right? And when you look at how disasters play out and what impact they have on certain environment, you certainly think about typhoons, strong winds, earthquakes, and so on and so forth. Could be political disasters, could be security issues. You come to the same thing when you say there is a disaster. Most of the time, infrastructure is failing. Most of the time, there's no more electricity. The internet breaks down. Houses are being destroyed. You are somewhat in a situation where you have none of that. And mind me, I don't want to. It's a little bit the same situation as the BOP communities. There's nothing. Right? There's nothing. And people build up tents and make makeshift camps, and then you got to deal somehow with it. People are flying gensets in and so on and so forth, right? So if that happens and if that comes up, you have to very quickly and very strongly be speedy on your response, and you got to have, existing technologies that can be quickly deployed to come in such an environment. We have done that. We have taken the technology that we had and we used it to access bottom of the pyramid to distribute solar power products, services, and so on and so forth. We have turned them, our technology is versatile and modular, so we can do whatever we want with it. So we have said, here is a shop where we sell products, but why don't we use it as a healthcare center, or why don't we use it as an educational hub, or things like that? And that's how we went into, refugee camps, and we worked together, with the United Nations and other players in the game to be able to build those, permanent structures in a very quick pace. It doesn't matter where it is, if there is roads and access to it or not, we can build it anywhere in a matter of a couple of days. You are ready. You're ready to go. You have electricity, and you can start with your service operations. Bringing that together, you can reflect that from a place where there's no infrastructure to a place that had infrastructure before but now doesn't have it. So I think these competencies that we have can be replicated across areas where you have disasters, areas where diseases suddenly break out. It's always about speediness, isn't it? It's speed. And even when we look at disease outbreaks, and now with the corona crisis, let's name the child by the name, right? If you look at the country, there are certain pockets where the disease springs up, and you got to be speedy and you got to be fast to bring the response there where it matters. And that's where our competencies certainly can be used and have been used in the past, basically.
Exactly, and also how well you're able to make modular systems and to adapt. It's super essential. I heard you saying that you can actually repurpose the kiosk into a medical center, right? And so in a time like this, obviously that's super important in places like refugee camps where the case for sanitation is high, but also how do you make sure that you can treat people and provide access to some sort of healthcare that makes sense? So definitely, as you said, let's call a spade a spade. It is a corona crisis, and it's currently forcing everyone to push boundaries and expedite the speed, as you mentioned, in which people need to innovate and apply creative solutions. What have been some of the key learnings for solar kiosks so far in terms of infrastructure, equipment, and training personnel in the mobile solar power domain? And what are some of the challenges that you anticipate for your industry?
So, when we were looking at the current crisis and when we did what we're currently doing right now, we saw that in disease outbreaks, in the response of some of the nations that have been very efficiently flattening the curve of infections, like Germany, South Korea, Taiwan, there's always one common let's say, way of how to tackle this, and that is testing. You test before you do anything. If you test, you can do a lot. I'm looking at some of the big foundations that have embraced this very early, and the way of treating is out there. Actually, very, very few people that have caught the corona do need to be submitted to some very complicated equipment like ventilators for artificial breathing. Most of the time, you can even treat with normal medicines like you would treat any other flu or disease to bring it down. But you need to know who has infected it, or who has, maybe now the malaria season is coming up in your country. Who has malaria? Who has COVID? How do you know if you cannot test? So that's where we came in, right? And we said, technology assists to test. There's technologies that can rapidly test, that can test wherever you are, and we got to embrace that, and we got to marry it with the solution that we have. So you go out, you find the right partners. We found a German leading medical healthcare application provider that does, molecular test labs and has the reagents to test for corona. We took those appliances, we put it in our kiosks, we put the solar power necessary for that. And now you can deploy the test lab wherever it is. And what we saw is that, initially when the first cases sprung up, it was always in the capitals. It was maybe in Nairobi, it was maybe in Lagos, it was maybe in Abuja, and so on and so forth. But then the disease spread across the country. Now what do you do? Maybe, yes, in Nairobi you have a test lab, a molecular test lab, so people can be tested there. But what do you do if somebody in Eldoret gets sick? How do you test this person? Do you take a swab, a sample, you send it back to Nairobi, you wait for 3 to 6 weeks until the result comes back. That person is maybe died, or maybe has already, gotten better in the meantime, but has spread the disease to how many people around it. It's about being, again, what we said before, you got to be where it happens. You got to be very rapidly, very fast, and you can use, technology that is out there to actually do it. So that's a little bit, the approach that we took. Now this approach is a very complicated one when you talk about, how to bring it out there, because it's a multifaceted stakeholder approach. Now there is, if you look at USAID Empower Africa, fantastic. Let's solarize, let's bring solar power to all healthcare facilities. I love this approach, right? But it's a very infrastructural approach. So if you talk with your MOH or with the government or whatever, you talk to the infrastructure guy of that. You're not talking to the virologist yet. And you're not talking, about the guy that needs to finance everything. So bringing that all together to make everybody understand, once you bring testing capacity out there, you not only have a way to fight against corona, but later on you can test for malaria, for HIV, for typhus, and so on and so forth. You know it, right? Name all those sicknesses, and you can sustainably strengthen the health care facilities across the country when you do that, and the technology is there. But for us, for example, what was very difficult and a challenge was to understand which appliances do I need to test for corona. I'm not a doctor, right? What is it? In the beginning, I was like, what is a PCR equipment? How do you write that? What's that acronym standing for? And that learning curve in a couple of weeks to understand all of this, to understand how do I translate those appliances that I need into the energy needs that I need to bring alongside with the infrastructure so we can build a test lab everywhere, was a very steep learning curve. And it invites cross-sectoral approach from healthcare over infrastructure up to finance in order to make those solutions work and bring them where they really need it.
Yeah. I definitely think there's a lot of key learnings, especially to take away. And I know you mentioned that cross-sectorial approach, which is really important, right? And I think what COVID-19 has brought to the fore is that it has impacted more than just healthcare systems. We've seen the fragility of different industries, from airlines to tourism to even, now energy, and how can you get energy to last mile, and even making that case. I also really like that Solar Kiosk is making a long-term play. a play for, okay, this is COVID-19. This gives us an opportunity to currently meet the demand for healthcare and services and testing, but it's also a solution that we can take forward towards the long term and do other things like treating malaria or any other sort of like pandemic. So it's building a robust and, would I say, anti-fragile system for the future, right? You also mentioned a case about partners, right? So Solar Kiosk has formed a powerful consortium with several leading entities, such as the United Nations Institute for Training and Research, UNITAR, and Siemens, among others, to launch mobile labs and healthcare clinics, which are based on Solar Kiosk's eHub module, to provide relief in the face of COVID-19's pandemic. So could you please tell our audience more about this plan, its key benefits, and the role of innovative technology and integrated connectivity in your prospective drive? That's a bit of a mouthful, so if you need me to repeat that, or did you get the question?
No, I got the question completely, absolutely. Awesome. How we came about this, I already initially elaborated a little bit about this. We saw very quickly that we really want to start at bringing testing capacity out there, which is for us key. You know, you go to the doctor. Why do you go to the doctor? Because he looks at you and he first wants to see what do you have, and then prescribes you medicine, and that needs to be there. And that's, you know, modern medicine. You can turn it as you want. So from that idea, we said, okay, what do we have? We have, you know, those installations that I mentioned before, those projects in the refugee camps where we build, you know, health centers with our technology. We said we have it already. So and let's say the innovative approach on that was for us more to take existing technologies that are there and marry them and bring one solution out of their solution. You take products, you tinker around with them, you make a solution. So you bring them together and make something new out of it. That's basically what we did, and that's how we came up, let's say, with the idea. And when you think about, you know, you have that lab out there, you have connectivity. Connectivity is also a key point in whatever you want to do, because if you think about the national healthcare system and, you know, the numbers of COVID infections that spread around the country, that's something that the Ministry of Health is eager to have. But next to that, you also are eager to start tracking patients and their health history, right? And that can only happen if you have connectivity and the software tools that you can use in order to record a patient, in order to record his health history, in order to disseminate this information and to get, you know, real statistics on the state of healthcare on wherever you are. And that's what really, you know, was what was driving us. The key benefits, as I mentioned before, so I'm a little bit repetitive here, is like, you're not bringing a face mask, you use the face mask, then you throw it away and you have to buy a new face mask. You bring something that's sustainable, that helps you to test and test and test again. And once Corona is over, you test for HIV, you test for malaria, you test for so many diseases. It's something that, you know, we thought about the reusability of this, and that's really where the key point is at, basically.
Yeah. But Thomas, how are you able to mobilize so quickly? I mean, you've mentioned so many different things that you're doing, you know, and all these other aspects of it, but how are you able to gather all of those resources so fast?
Working 26 hours a day. You know, as I mentioned before, it's quite nothing unusual that we took the technology that we have and that we initially designed to be a distribution hub and turn it into something else. So we have practice on how to do that whatsoever. Of course, there needed to be, you know, a deep understanding of, you know, medical appliances, of, you know, surface technologies that you can treat, you know, with antibacterial solutions, of going out and going in our existing networks to identify, you know, partners that could join forces with us there. And yes, I won't hide behind the mountain that was like quite a difficult task, and it's still not over yet. You know, it's a fluid movement. We always, you know, get to find new partners that want to come in and bring amazing solutions. Like recently we found a great solution that can use solar power to turn water and salt into a chlorine solution that you can use to disinfect surfaces, treat wounds and other stuff. It goes on. It's an ongoing process, and you need to be at Solar Kiosk. We always been very, very much on the core of, you say innovation, we say R&D. It's you got to look what's out there. You got to talk. It's a strong partnership approach. That's what it's based on. Coming back to the point where you said, you have such amazing partners. I think. Sustainable Development Goal number 17, if we talk about 17, the 17 SDGs, is about partnerships, isn't it? And partnerships, from the top level organizations down to very humble companies like us. Only if we work together, we can bring such solutions together and we can make them work somehow. Yeah. But let's not hide behind the mountain. It's a lot of work, yes.
Yeah, definitely. So speaking of obviously mobilizing so quickly and having partners, what is your plan in terms of the countries and regions that you're looking to deploy the labs and clinics in? Where are you going to do that?
So, Jesse, since we launched this solution, we got, in the first 2 weeks, we got, tremendous, response to what we have there. I think we're discussing with over 26 government, Ministry of Health, COVID special employees, and so on and so forth. We have expression of interest from numerous countries that really, need to have this solution on the ground. So I'm going from East Africa over to West Africa, South Africa. We are discussing with, Southeast Asia, Central Asia, and countries in Latin America. I mean, we're in this together. It's this virus is now everywhere. Everybody who says we don't have cases, well, I don't think so. Maybe you don't know that you have some because you cannot test, but it's like everywhere. So who do you want to exclude? Who do you want to include? Right? It's not possible. So you listen to everybody. You work 24/7 and you try to cope with the need that is really real out there.
Yeah, and I think that's great, especially in terms of getting your partnerships around. And as you said, we're all in this together. This is a global pandemic and it is affecting everyone. I'm glad that you're able to deploy your solutions all over, and even to Southeast Asia, Latin America. I think probably maybe new frontiers in terms of maybe solar kiosks. So my second question for you based on this consortium is, the consortium has heeded the World Health Organization's call for strategic preparedness and response plans to combat COVID-19 from various vital sectors. You mentioned a cross-sectorial approach. How, in your opinion, can mobile solar solutions support the immense role and responsibility of this key organization?
Jesse, I think from what I see today and where we are at, and why I'm a bit worried, for many, countries that are facing unprecedented challenges, not so much Germany, because, the healthcare system here is working very, very well, is because healthcare systems across, those nations are weak. They're erratic. They don't really work. There's no, reliable healthcare system in the last mile communities. You talk about global health. Global health is especially for everybody who don't even have access to the healthcare system today, right?
Yeah.
Solar powered solution can offer, tremendous opportunities. You don't have to do something very complex like our lab. This is already, molecular, testing laboratories is quite complex thing. But, what we also did is we quickly got together and we created, solar powered, let me call it mobile suitcase. And, those health workers that go out periodically to, last mile communities and villages to deliver healthcare there. You can include something like solar power and it can help a lot. Do you remember our good friend Laura Stachel, right? Who is?
I was just thinking the same. Yeah.
I mean, it's about a basic light, for crying out loud. When you give, when you give birth to somebody, and in the middle of a difficult, birth in the healthcare center, the kerosene is out and the light goes out, or you try to tinker around with a candle and a kerosene lamp, and it doesn't work.
Yeah.
A simple mean like having a light in there, for crying out loud, give those people a simple light, and a simple light with a Pico solar solution. Here is your solution. It's not that difficult, isn't it? Up to what we just discussed, like powering healthcare centers with a little bit of solar. It doesn't need a lot. You have some lights, you have maybe a computer and internet connection so you can connect to the healthcare systems. You have a couple of, basic things in there. Solar can, bring tremendous changes. And I think right now we have this trend that many governments are actually starting to understand this and saying, okay, we got to power our healthcare centers. In Kenya, there was quite, a good work being done on this in the past. You reached out to a lot of communities. Already many healthcare centers are, solar powered, and it's tremendous. I mean, if you look at the COSAP programs by, the World Bank and other things, that was done. It's fantastic. But there's so many other countries out there that are less fortunate and where you still have nothing. And bringing solar there today is very quick. It's very rapid. There's no, there's no big issue with it. You can immediately come. You can help to be able to treat patients, and you can help your healthcare staff. Jesse, think about, you are a trained nurse and your government sends you up to Eldoret and you live somewhere. There's not even a light. There is no TV. You have to work your ass off to try and save people by the shining light of a kerosene lamp. How long are you going to stay out there? If you want to retain your staff, and if you want to give them, something to, at least some convenience to say, okay, I'm staying here. I'm taking up this fight, and I'm going to be helped with a little bit of something, with a light, with something. Yeah. Then you're gonna, also look at the staff that needs to work in such centers. I think, and we can go on with all this. I think it's very clear for me. I mean, of course, it's got to be this way.
Yeah, I mean, you've highlighted something, like the training of these healthcare facilities and healthcare workers, and especially, even them going in and having conditions that facilitate better treatment of people, right? That is super essential. And I know that the training of community-based health workers is a central component for your rapid response initiative. It's part of that philosophy that you need to be there on the ground. So tell us about this aspect, and what are the challenges of quickly training people to effectively manage various solar power solutions in remote, vulnerable communities?
Well, I think it's a little bit, is solar really that complicated, Jesse? Since, the first D-Lights and Sun Kings have been sold in Kenya, I think so many people know about solar, and it's not really like something really complicated today. You have fantastic products out there that are easy to use. You don't need to explain a lot. I think people have understood how solar works. Does there really have to be too much training on the solar side? Not really. When we come in and we put our lab, yes, it's a little bit more complex. All right, I admit that. But, we put it there, we implement it, we connect everything, so you don't even have to think about this is solar powered. It's just energy is there, use it, and then you use the appliances. So our training goes more about, WHO guidelines for how to treat people, how to behave in the case of Corona, WASH program, and so on and so forth. How to treat the medical, lab equipment. But to train people on solar, it should be rather quick. You say, here is a button, you switch it on. When you want to, charge it, here is the panel, put it in the light, clean it from time to time. What much more do you need to do there? I think it's even a very enticing thing, because there's not a lot anymore that you have to do with the current solutions that are out there. So our training focuses more on, preparedness and guidelines and all of those processes and all of those things, how to deal with COVID patients instead of telling them, oh, here is a solar panel and the photons hit the surface and you don't do that, right? You don't need to do that, basically.
Yeah. Okay. So it's just that simple. You've got this pattern. This is what you need to do, and that's it.
Yeah.
Wow. Yeah. So it seems like it also continues to push in that narrative about being very quick and being very speedy in deploying, resources to solve certain situations. So my last question for you before we go into audience questions, I'd just like to remind the audience that this is part of the hashtag Find the Pioneer talk show series. Definitely people like Thomas are speaking out and making an active change by delivering and creating products that ensure that we have a more robust and sustainable community, right? So make sure that you share this podcast or this actually live with people and encourage them to apply for the Zayed Sustainability Prize. In fact, as I mentioned earlier, Thomas is one of the winners of the Zayed Sustainability Prize in 2020. He's a finalist, actually, my bad. Under the energy category, what were the key learnings for Solar Kiosk, and how did your nomination support your core business mission and commitment to the UN SDGs in your home region of East Africa and internationally? Yeah, sorry, I want to keep up there.
Yeah, what was my key learning is I apply again to win it next year.
I love that.
We were just a finalist, but we were a very proud finalist, and
that's an important thing. Sorry to cut you short, Thomas. It's super important that you keep trying, right? Like, you shouldn't just give up if the first time you don't succeed, right? Because this is a journey. It's more about the long steps that we take in achieving the goals. Sorry, Thomas, please continue.
Or in being an entrepreneur, Jesse, right? If you're not persistent, if you give up at the first hurdle, okay, well, then it's the wrong place for you to be at.
Definitely.
No, we were a very proud finalist, and it's been an amazing journey. It's been tremendous. I can also proudly say that we were chosen by the audience to be the winner, but not by the jury. So we were just a finalist, but the audience loved us most. Anyway, be that as it may, I mean,
I'm sure you've applied already. Yeah, exactly.
I will see you there, my friend.
Fantastic.
So it's been great. We had a really professional event that was amazing to follow. The amount of innovation and great people in the room, of great solutions, great products, great programs that we got to know in this event. The exposure, through the relentless activities of the Zayed Sustainability Prize to promote what happens there and to promote the companies that are in there. I mean, you can pay that with cash. It's just very, very amazing. How does it support my core mission and commitment to the SDGs? We've always been committed to the SDGs and always strive to help to achieve those. Time is running out, so everybody gives his best. But to find an organization like the Zayed Sustainability Prize, who has exactly also this mission and vision and tries to help companies like ours, was very amazing and fantastic. And that's why we're going to try again and again and again until we win. Maybe in 2013. Yeah. I don't know. We'll see about
Hopefully sooner.
Yes, absolutely.
Definitely. I mean, you can see that Solar Kiosk has been amazing work, and lots of other people have also been participating and doing exciting work, and even providing this platform for us to have this dialogue, is also an opportunity to get the word out about Solar Kiosk. So, it's not just winners, it's also finalists. So just apply, and there are many opportunities that you can get by applying for the Zayed Sustainability Prize. Application deadline has been pushed. So ladies and gentlemen, please take this opportunity to apply. You will not regret this, I promise you. Now, we've got 2 questions from the audience, and this will be as we're just about to wrap up, Thomas. So Dalal first starts with a comment saying, it's very impressive to see the upcoming projects undertaken by Solar Kiosk, so kudos to you. And she asked, are there any water, energy, and food nexus solutions that Solar Kiosk will roll out? And then I'm going to give you the questions both at the same time. And any advice to SMEs in surviving this pandemic?
So let me take the first one. So water, food, and is something we did. We did it a lot of times. Very early on, when we came, to our communities, we saw that water is a big issue, especially if you go to arid areas, Masai Mara and other areas that you know well. How do you go about that? So what we did is we used solar power technology to power, filtration technology, and to turn, somewhat murky groundwater or borehole water into something that is drinkable, to something that you can, irrigate your lands with it. So in the agricultural space, which of course, already is in the food space, you can irrigate your fields. You're able to ensure that you're going to collect harvest, even if the rainy season is delaying or not coming at all. That nexus, we had done a lot of work. We had done a lot of work because we were in over 200 agricultural communities, and all of them were agricultural communities. There's not a lot of commercial activities going on there until we came. So you work with those people, and you work a lot, in the space of water, in the space of agrotech, in the space of, even getting quality seeds out there for the people to be able to even work on their fields and work on a harvest that hopefully comes in a couple of months, or you use irrigation and that it will be sure that it comes. Yes, we have done a lot in that, and we will continue to do so, and we will put a very, very strong focus on especially that component in our traditional work. Any advice on how SMEs can survive the current difficulties? It's not an easy question. It's a tricky question, but I would like to invite you guys to, go out to the Gogla, go out to a couple of those organizations, IFC, World Bank, other people have fantastic resources out there for you that are all published, that are targeted to help SMEs to get through the current crisis. Please look, please read. There is grants, there is funds, there is cheap loans, there is, all types of instruments out there for SMEs to apply for. And, if you're really in a sort of a Kahoot right now, please go there and check it out. It's too sad to see not only people dying, but amazing innovative company failing due to this crisis. So I invite everybody to go out there and do some research.
Okay. Thank you, Thomas. Definitely, those are good words to end on, in terms of where people can go. The IFC, the World Bank, they do have resources that you can leverage. So once again, thank you so much, Thomas, and thank you so much to Solar Kiosk for providing this time to be on the hashtag Find the Pioneer talk show series. And you've been an excellent guest. It's been amazing to have you on and just hear such depth and insights that you have about how solar and how mobile solar clinics are actually impacting the world that we live in today. So, ladies and gentlemen, sorry, yes, you're about to say something.
I wanted to say thank you so much, Jesse. You've been a fantastic host. I'm looking forward to our next talk next year.
Indeed. When you are a winner, inshallah.
Yes, exactly. Inshallah.
Inshallah. So, ladies and gentlemen, this is the spirit that we bring here with the Zayat Sustainability Prize. It's one of collaboration, it's one of friendship, and it is one that promotes the best ideas for going forward and allowing a platform for SMEs to engage. Another resource that you can actually apply for is the Zayat Sustainability Prize. right? So make sure that you do that, because there is a $600,000 grant that is $600,000 grant that is given aside from the benefits of enjoying and getting to collaborate with community members. So I just want to remind you that if you know a pioneer, if you know someone doing amazing work within these categories of food, water, health, energy, and even global high schools, make sure that you nominate them. info@zayedsustainabilityprize.com is the email to send your emails to. Nominate those pioneers, and someone in your community will be contacted and making sure, hopefully if they win, that they can impact their community and the world at large with their sustainable solutions. Let COVID-19 not be the failure of SMEs that are doing great work. That's a very good quote that I got from you, Thomas. So from me here, representing the Zayed Sustainability Prize, bye for now, and I will see you very, very soon. Do stay safe.
Asante sana, Jesse.
Karibu.